What a morning! Don Berwick, of course, was pitch perfect, as always, just wonderful thought leader and an inspiration to all of us. So there's a quote from Maya Angelou that I've always been fond of, and I think it's appropriate for this morning and for our very special next speaker. Maya Angelou said, "I've learned that you shouldn't go through life with catcher's mitts on both hands. You need to be able to throw something back." And we know that Hillary Clinton has spent her adult life throwing back. When she ran, yes, I agree. I agree. When she ran in the 2008 presidential primary, she received, as we all know, 18 million votes. And as it was described, she made 18 million cracks in the highest, hardest glass ceiling in the world. Yes. Next time it will be easier. And it will be easier because Secretary Clinton didn't run as a woman. She ran because she believed she was the best person for the most important job in the world. Throughout her, I think this is like introducing a rock star, right? I mean, oh my God, the highlight of my life. Throughout her long career as a public servant, Hillary Clinton has succeeded in what she calls smart power. And smart power is the ability to learn new things, adapt to new situations, and complex change. All attributes that she's demonstrated time and again as she has moved from challenge to challenge. As Secretary of State, we know she pushed the frontiers of human rights and demonstrated that giving women opportunities is vital to security and stability and prosperity of all nations. As the First Lady from my home state, New York, she worked to provide health care for children, create economic opportunity, and she was there to support first responders at ground zero. And just a few weeks ago, partnering with our friends at the JED Foundation, the Clinton Foundation hosted a town hall without walls focused on college, health, and mental health and wellness. Much has been written about her leadership style. She inspires action, communicates authentically, and builds bridges. But what resonates for me most, and I think with many of you, is that she has the heart of a great leader, someone who leads with purpose and serves with pleasure. That, and of course, what is very important to me is that she is about to become a grandmother, the best job in the world. So please join me in welcoming Hillary Rodham Clinton. I told you. That was great. Oh, you're fabulous.
So nice.
You are fabulous.
Good morning. Good morning, everyone. Wow. Thank you. Thank you so very much. Thank you, and thanks to Linda for those very kind words and also for her leadership of this really important, vital, and growing organization. I want to thank Jeff Walter and everyone at the National Council for Behavioral Health. But most of all, I want to thank each and every one of you for the work you do every day in our neighborhoods and our communities to increase access to mental health care and addiction treatment services. You are saving lives, you are healing families, you are strengthening communities, you are giving Americans all over our country hope for a healthier, happier, more sustainable life. So give yourselves another round of applause for what you do. You know, I was thinking about what an honor it is for me to be here speaking to this organization, continuing a personal commitment that for me stretches from Arkansas to my time as First Lady, to the Senate, to the State Department, and now to my work at the Clinton Foundation with Bill and Chelsea. I think that the issues you are living with, that you are advocating for, are among the most important that we currently face as a society. And we'll get into more of that in a minute when Linda and I talk, but I just wanted to really urge you, as you not only attend this great conference, but you think about what you're going to do on the Hill tomorrow and what you do back home, to keep working to raise the visibility and the urgency of the issues that you know so well. You know, later today, my friend Mayor de Blasio will be here with his wife Shirlane and his daughter Kiara, and their family will help launch the National Children's Mental Health Awareness Day. I've known Bill a long time. I've known Shirlane. She and I attended Wellesley College, she after me, some years. But I think they've been extraordinarily courageous in talking about the issues that they have faced in their own family. And I'm very touched by their willingness to step forward, speak with you, and to help lead the efforts to recognize the importance of the issues, the constellation of issues around mental health. Now, we'll talk about the changing world and challenges facing our country. There's certainly a lot of issues and challenges to talk about, from Ukraine to the Affordable Care Act. But first, I wanted to say a few words about why the work you're doing is so important, and to emphasize particularly the new emphasis here on the treatment of substance abuse. Let me begin with a disturbing development that I know is top of the mind for Mayor de Blasio and for many of us, not only in New York, but across the country. Yesterday, the New York Times published a story about the rise of heroin addiction in Staten Island. In fact, they called it heroin's new hometown. I've been to Staten Island a lot. The people there are solid, hard-working people. They are all races. They come from all backgrounds, a lot of professionals, a lot of city and state employees, particularly in law enforcement, firefighting, police department, and the like. The number of people dying there from heroin overdoses is the highest it's been in at least a decade. Treatment facilities are overflowing, at least they have some, but of course it's not adequate to the challenge they're facing. Families and caregivers are looking for help. Now, you know these stories better than anyone, and it goes far beyond Staten Island, New York City. It goes to every kind of community, small towns, suburbs, rural areas, all over America. An evolving epidemic of addiction and overdose is claiming new victims, and for every one victim who is the victim of the overdose, there are so many other victims, family members, and others who cared for this person. It's part of a toxic cocktail of economic and social pressures that's fraying the social fabric and making it harder and harder for too many Americans to live the lives they dream about and deserve, and to cope with the stresses that they confront. And here's another statistic that stopped me cold when I first read it. Many American women today are actually living shorter lives than their mothers, especially those with the least education and the lowest incomes. Shorter lives than women in any other major industrialized country. That is a historic reversal in life expectancy. The only statistic it rivals is the decline for Russian men after the disintegration of the Soviet Union. That is just not what one would expect in our country. We have great services, incredible medical interventions. We have advanced technology. That is not something that should be happening here, nor is it something we should accept. Now, when I delved into it, there was no single explanation for why a certain group of American women are dying younger. But it correlates strongly with unemployment and economic stress. And we know that overdoses from prescription drugs have risen dramatically over the past 20 years, especially among women, undermining the progress we've made in other areas, like reducing the rate of heart disease. The biggest declines in life expectancy are coming in communities hollowed out by inequality and poverty. In struggling rural counties and crumbling Appalachian towns, in places plagued by smoking, obesity, drug use, teen pregnancy, and domestic violence, where wages have stagnated and jobs have disappeared, where social networks that provided support to Americans in previous generations are weaker than ever, where schools are just overwhelmed by the problems of their students, where protections for workers, including labor unions, are shrinking, where government is less trusted and, frankly, less dependable, where families are more fractured. Women trying to build lives and families in these places don't just face ceilings on their aspirations and opportunities. It's as if the floor has collapsed beneath them. To address this challenge, to help more of our neighbors and our fellow citizens regain their footing and live fully and live healthy lives, we need to be honest about what's happening in our country. We need to take a very clear-eyed view about some of the causes of this social collapse. There's much more we can and should do to help hardworking women and men across our country lift up themselves and their families and contribute again to their communities. We need to keep expanding access to health care. And for women, we need to ensure equal pay for equal work. We need to raise the minimum wage. And this is really a point that this organization would understand. You know, the debate about economic inequality is often carried out in political terms or economic terms, but it's a social problem. It's a psychological challenge. We need to start demonstrating our care for one another, particularly those that are struggling the hardest. We need to give parents flexibility on the job and paid family leave. We need to invest in early childhood, particularly our youngest children. We need to support affordable childcare. It's not only the right thing to do, it's the smart thing. Because if we, once again, empower people, particularly those women and their daughters that I've been talking about, we can begin to rebuild that floor and reverse these trends and help more Americans live longer, healthier, fulfilling lives. You, better than most, will know we have to get serious and creative about stemming the tide of drug overdoses and dependency. Last month, New York City announced that police officers, EMTs, and firefighters in Staten Island will start carrying the anti-overdose medication naloxone to try to save more lives. And naloxone is a drug that can make a real difference, and that's one of the reasons why the Clinton Foundation is making the provision of that a priority. And it came about because of a personal connection with a family that had a tragedy. In 2012, a young man working as an intern for me in the State Department, unbelievably bright, attractive, charismatic, going to law school, really the whole world in front of him. Had a few beers out at dinner with some friends and went home and had to study for an exam, and one of those friends gave him a pill. Should have known better, hadn't done it before, but he took it, studied for a few hours, went to bed, and never woke up because of the interaction of the opioid and the alcohol. And, you know, probably dozens and dozens of young people could do that without any ill effects, but he wasn't one of them. And then a neighbor where we live in Chappaqua, same thing. Bright young man, done with school, working hard, same thing. Had a few drinks, came home, wanted to watch a movie with some friends, took the pill that was given to him. After the movie, went to bed, never woke up. With those two losses of those two young men, one we knew very well, the other we knew because of his family living in our town, my husband decided that we had to try to do something through the Clinton Foundation and one of our initiatives, which is called the Clinton Health Matters Initiative. It's been working with government agencies, colleges and universities, the healthcare and pharmaceutical industries and community organizations to expand access and to reduce the number of overdose deaths, especially among young people. Naloxone is safe and effective, but it's not widely available outside of a small but growing number of community distribution initiatives. So we're drawing on lessons learned from our efforts in the Clinton Foundation to lower prices and increase volume of life-saving HIV/AIDS medications in Africa, something Bill started right as soon as he got out of the White House. The goal is to increase the available, affordable supply of naloxone, to encourage more communities and organizations to demand it, and eventually to cut in half the number of deaths caused by prescription drug overdose. Later this month at Johns Hopkins University, the Clinton Foundation and its partners are convening community leaders and healthcare practitioners and representatives from both the public and the private sectors to discuss a comprehensive strategy for the prescription drug epidemic with a focus on scaling up access to naloxone. And as you heard Linda say, the JED Foundation and all of you are partners. Because the Clinton Foundation formed a partnership with the JED Foundation to expand the capacity of colleges and universities to prevent substance abuse and support the mental and emotional needs of their students. This effort launched in January at over 30 campuses, and we hope to keep that number growing. The idea is to build on the JED Foundation's existing mental health programs with new emphasis on substance abuse and suicide prevention. We're working with MTV and Facebook, trying to reach as many students as we can with a message that will resonate and best practices that will save lives. And we want to equip young people like those two young men to know what questions to ask, to know, yes, one pill mixed with alcohol, or maybe just one pill because of how your system operates could be fatal, or certainly could lead you to having to go to the hospital. The National Council for Behavioral Health is on the front lines of this important fight. You have trained nearly 150,000 specialists to fan out into communities and connect people who need help with mental health and addiction care services. Your publications, conferences, and other services, including the Find a Provider tool online, are invaluable. So you're doing all this at a crucial moment. For years, many of you have worked to end discrimination against Americans with mental disorders or a history of substance abuse when it comes to health insurance and care. As a senator, I sponsored legislation on mental health parity, equitable access to substance abuse treatment, but it was always an uphill battle. But finally, thanks to legislation, including the Affordable Care Act, more Americans are gaining access to needed mental health and addiction services and coverage. We are slowly moving toward a more integrated, comprehensive model of care. Under the law, all new health plans will now cover preventive mental health services, such as depression screenings, and insurance companies will not be able to deny coverage because of a pre-existing mental health condition. Now, I know there are still many complaints and concerns about the Affordable Care Act, but I've been struck by the polling that I've been reading because it tells the same story. A small majority of Americans don't think they like the Affordable Care Act, but a large majority of Americans don't want to do away with the protections that are in the Affordable Care Act. A small majority wants to repeal it, but that is slowly receding as a rising majority says, no, fix it. Well, that's in the tradition of good old-fashioned American pragmatism. Yes, there are things we can fix, but just the pre-existing condition elimination in and of itself is such a huge gift to so many tens of millions of Americans and their families. They never should have had to fight for it. We never should have had to pass legislation for it. I mean, when you think about it, yes, you're sick, or you were born with a condition, or you've developed some kind of chronic problem. You're the person who needs insurance. I mean, really, the system was backwards before. We're straightening it out. It should help lead to lower costs and better outcomes for millions of Americans. But look, change is never easy, and therefore we look to leaders and experts like you to help people and elected officials stay focused on what's important, to help remind us about the differences we can make in people's lives. Now, I have a little bit of experience in knowing that it can get discouraging when you're grappling with big challenges. That's called resilience. But having traveled literally to 112 countries and nearly 1 million miles, I always came home so grateful for our country, despite how crazy we can sometimes be and act, and how dysfunctional our political system can seem, and our economic, problems. Despite it all, I was always so proud and so grateful. And yet I think we're in for another one of those periods in our history where we have to stand up and fight for what we want to see in America again. We have to deal with those hollowed out communities. We have to deal with those people in despair. We have got to find work for the 6 million young Americans who are neither in work or in school, whose whole futures can be adversely affected by that. And look, I know, I hear it. I heard it around the world. I hear it here at home. There's a chorus of doubters and minimalists who say, look, we can't do big things anymore. Our politics are too broken. Our budgets are too tight. Our horizons are too small. That's not the America that I see. I've learned that the things that make us who we are as a nation, our openness and innovation, our diversity, our devotion to equality, tolerance, and opportunity, are beautifully matched to the demands of an increasingly interdependent age. So despite all the hand-wringing about decline, the United States is actually uniquely well-suited to lead in the 21st century. And if if you look at American history, just certainly within the last 50, 60 years, you know, we've always gone through tough times. We've always had political debates. There have always been doubters. When I was growing up, people were afraid that, you know, Sputnik meant the end of the American experience and experiment. When I was practicing law in Arkansas, our country faced stagflation and oil shocks. When Bill became president, it was a growing deficit. It was outsourcing, the apparent decline of American competitiveness. We always go through these phases, and each time, once we finally get around to facing up to what's going on, we pull ourselves together and we outwork, out-innovate, out-compete every rival, and we take care of our own people. We keep this country as the shining example of what a large, sometimes contentious, very diverse population can achieve. That's what we've always done, to extend ladders of opportunity to more people in more places, to build, to create, to inspire. You know, I love going back and reading the French writer Alexis de Tocqueville, who visited the young America back in the late 1820s and 1830s. He came and he was amazed by what he saw. You know, it wasn't like the aristocracy that still ruled much of Europe that he was familiar with. He was amazed by what he called our habits of the heart. The early Americans were innovators and explorers. The very idea of America was such a bold invention. They were also volunteers and problem solvers. They believed that their own self-interest was advanced by helping their neighbors. So families traveled for miles to help raise a barn or stitch a quilt. Like Benjamin Franklin, they formed volunteer fire departments. They believed in active citizenship. They believed we all have a responsibility to lay our shoulder to the work of the day and to build our country together. That is what made America's great democratic experiment possible and made this an exceptional nation. What was true then is true now. You are here today, and what you do every day is because you have those habits of the heart. You see people suffering, and you want to be there with your colleagues to help end that suffering. You focus on people that are often marginalized and kicked to the side by others. You fight for the services, and more than that, the sense of caring, the ethos nurtured by habits of the heart, to make sure that no person goes on life's journey alone, desolate. You can't save everybody. You can't help everybody. That's human nature. We understand that. But our caring nation, our ethos of service, our habits of the heart demand that not only professionals like yourselves, but all the rest of us supporting you do what we can to give every single person a chance to fulfill their own God-given potential. And if that's dealing with a mental health disorder, overcoming a substance addiction, then so be it. They are our brothers and our sisters, and we are stronger when we stand with them. Thank you all very much. Thank you.